Okay, how to use a pipette. Well, the first thing to do, of course, is to choose the correct pipette for what you want. They do come in some different sizes, but you will notice that they are color-coded. Now, the main volumes that you'll be using is 1 ml and 0.1 of a ml. The blue pipettes, or the blue top, are the ones that we use for 1 ml, so they go up to 1,000 microliters. It's written down the bottom as well. The yellow pipettes, they come in a couple of different sizes, but they go maximum up to 200 microliters, which is 0.2 of a ml. So you'll be using the yellow ones for your 0.1 ml. There are also other yellow ones which only do 0.02 of a ml. Make sure that you don't use those, although they will probably be on your rack. Always make sure that you check the measurement. If you're not sure, check with one of the demonstrators. All right, now, with your pipette, of course, there's the plunger up here, the tip goes underneath, and the little section here shows you what volume will actually be sucked up and pushed out again. So what you'll need to do before you use any pipette is to set the actual volume. So the volumes you read down, you'll notice that there's 4 numbers. So to get 1 ml, that needs to go to 1,000. All you have to do really is turn the top until you get to 1,000. Whoops, a bit too far. All right, so that one is now set exactly to 1 ml. With the other pipette, the 200 microliter one, you'll notice that yes, there are still 4 numbers, but there is a line in the other one. Count that as a decimal point. So if you want 0.1 of a ml in this case, you need 100.0. So make sure you set your pipette accordingly. Okay, now much like your pipettes are color-coded, so are the tips that go onto them. So the blue top pipette gets the blue tips, yellow top pipette gets the yellow tips. When you're putting a tip on a pipette, you'll notice that they are sterile tips, so only keep the lid open when you're actually putting one on, then put the lid back on. All you do is you hold your pipette, push that down there, and your tip is on. Now, if you think it's still a little bit loose, by all means grab the neck of it and push it up a little bit, but don't grab the bottom because then it's no longer sterile. Okay, so that's how you put the tip on. Another thing with pipettes, always make sure that you handle them at a vertical angle. Certainly never hold them like this, and certainly never completely upside down. Otherwise, liquid can run into the barrel of the pipette, and you'll be spending your lunch hour stripping it down and cleaning it, because the lab techs will be very upset. All right, now when we use a pipette, basically this is how you hold the pipette. You'll notice when you get into the lab and you practice a little bit that the plunger goes down to a slight resistance, and then you can actually push down a little bit further. This is pretty important when we're sucking up and pushing out liquid. When you're first sucking up liquid, you first depress the plunger down to that first resistance. Then and only then do you actually put the tip into the liquid, and then you very, very slowly aspirate it up, and there is exactly 1 ml. Now, if you put the tip in and then depress the plunger, all that you've done is created bubbles, and your bacterial culture is now airborne. Not a good idea. Also, if you don't aspirate very slowly, if you release this plunger too quickly, in other words, the liquid can once again be sucked up into the barrel, and guess what you'll be doing in your lunch hour? All right. Now, when you're then transferring that liquid, you don't touch the sides of the bottle. You just put that tip there. Now this time as you depress, you go past that resistance on the top all the way down. So all that does is it pushes that last little droplet of liquid out. Now the last thing to do, of course, is to get rid of that tip. There is that little button on the side here. The blue tips are considered soft waste, so they go into this bucket here. There you go. If you're using the yellow tips, they're considered sharp, so they need to go into the sharps container. And that's pipettes.